Hello, good morning, class.
Good morning, sir.
Good morning, sir.
Good morning.
Good morning, sir.
I want to apologize for keeping you waiting. Please, can you hear me?
Yes, sir.
Yes, sir.
Great, great. So you can let your colleagues join. Let your colleagues join. Okay.
There are a number of reasons that comes for you in Kenya. So they just follow that and they kill themselves for the land. Hallelujah.
All right.
What about you and me? We said,
So I want us to start today's lecture. All right. So please, I want us to start today's lecture with some trial questions. All right, Gloria.
Sir, good morning.
Please, good morning.
Sir, please, about the 20 principles of teaching and learning, we only have slides from 1 to 10. From 11 to 20, we don't have it.
Yes, I said from 11 to 20 because of the volume and the time. It's rather given in the handout, but it's not in the slides. Yes, please.
Thank you.
You are welcome. So please, I want us to start with some trial questions to remind us of what we learned last week on the teaching methodologies. So last week, we looked at a number of them, about 3 to 4 of them. So before we continue, let us test ourselves. So please, if you are ready, you can just get a pen and a paper. I have 3 questions for you on the teaching methodologies. I will project the first question. Then you look at it and one of you can tell me what you think the answer is. So there are 3 of them. We'll discuss them. Then we move forward to today's lecture. So the first trial question, are we ready?
Yes, sir.
Okay. So the first question is on the screen. So read the question on your screen. And if somebody's ready, you can tell us what your answer is. Okay. Okay, so Araba, can see Araba Ampa, please. What do you think is the answer? Hello, Araba. Star Araba, please, can you hear us? Oh,
yes,
okay, then.
Sir.
Please.
Sir, please, the answer is demonstration.
The answer is demonstration.
Yes, sir, I can hear you.
So, please, she said the answer is demonstration.
Yes, sir. I want to explain
Please,
something.
my answer is demonstration.
Do we all agree?
Yes, sir.
Yes, sir.
Yes, sir.
Okay.
We agree.
All right. you want to do a workshop on effective hand washing practices, the best or the most appropriate teaching methodology to use is by way of a demonstration. Okay. Why not lecture? Can't you give a lecture?
No, sir. The lecture is mostly about the teacher talking so much. But with
Okay.
the demonstration, if it's been done in front of the people, it's rather stick better because they are seeing what the person is doing. So it's rather stick better. So whenever they
Okay.
remember it, it's still in their mind. And I think the
Okay.
demonstration takes about 95% of retention. Thank you.
Okay. Wonderful. I like the last statement. The retention, memory retention. Great. When you look at the chart, the memory retention demonstration, yes, it takes a greater percentage. So we all agree the answer is demonstration. Yes, it's true. It's the best way for effective hand washing practice. All right. So the next question. So the next question is on your screen. Read the question and let's see what the answer is. The hands up, are they old hands or new hands? Juliana Amisa, is it an old hand or new hand? All right, I've seen a new hand now. Doris. Please, Doris, you can unmute and talk.
Brainstorming. Please,
The
sir, the
answer
answer is brainstorming because it improves interpersonal relationship. Brainstorming.
So we should pick brainstorming. Please, do we
Yes, sir, because it
agree?
improves
Yes,
interpersonal
sir.
relationship among members.
All right. So brainstorming create or it brings about interpersonal relationships. All right. So that is true. We said in brainstorming, you present a topic and you can have about 2 or 3 people or more than that in a group. They think about it, bring their ideas, and as there are 2 or 3, there's a relationship which is interpersonal, more than one person. So yes, brainstorming is the best answer. Now, if you are also told that this kind of teaching methodology, the principle it operates on is that quantity generates quality. And this teaching methodology, it operates on a principle that quantity generates quality. So which of the 4 answers, which of the 4 options would be the best answer? If you are given another question that this
Brainstorming.
brainstorming. Yes. So quantity generates quality. It is also the brainstorming teaching methodology. So as so many people come together, they bring so many ideas. That's quantities. Then we look at the ideas and we come out with quality, some fewer points by making some of them. Right. So let's look at the third question, the third but last question for this. So the third question is on the board, is on the screen.
Lecture.
Lecture. Do we agree?
Yes, sir. Lecture.
Yes, sir, we agree.
We agree. Why? We agree.
Okay. All right. So just like we are doing currently, so we have less weeks, but we want to do quite a number of things. So we have to use a lecture method to be able to cover much. So yeah, it's true. It's lecture method. All right. So just go over them. Go over them. What we have done Just understand the basics so that when you see a question in any form, but you should be able to know which of the methods that could best fit the situation. So thank you for your participation. So let's do another one.
More
on
questions.
Don't worry about sister. For today, we'll do the three. We'll go on. Are you okay? All right. So today I want us to look at one last teaching methodology. So in actual fact, we are left with three, and the three are role play. Where role play is left, and then case study, and then clinical simulation. But by looking at the schedule, I really don't have enough time today to spend with you. So I will do as I think what I think is most important and what you are likely to meet in the exams. So let's do, because of the limited time, let's do what is most beneficial. The rest you can read, but we have an exam ahead of us. So let's do clinical simulation with the less time we have. I think a lot of us, we have attended workshops before, and these workshops we have attended, these workshops are to teach us effective ways of doing some of the basic procedures that we are doing as midwives in the world. So when we go for these workshops, some of them, you realize that you can have a clinical simulation where, for example, there's a case that involves, let's say, essential breastfeeding, or there's a case that involves how to resuscitate a newly born baby. So let's put it there, the golden minute in resuscitating a baby just after giving birth, the golden minute. We know that the golden minute as midwives is very important for the survival of the baby. And the golden minute is very important. So we can use the golden minute as a clinical simulation. How do you, as a midwife, how do you meet the golden minute? So we can give a case, a clinical simulation case.
Oh,
Where
this
we
is you, Karama.
can,
Need I live yeah.
So we are saying that a clinical example we can use for clinical simulation is to use the golden minute as midwives. And in using the golden minute as a clinical simulation, what we are trying to do is that we will have a midwife who is to resuscitate a baby immediately after birth. And there are certain activities that you have to go through within the minute that we are looking at. So we can present that case and we can have a baby who can stimulate the baby and ask you to act it out in a clinical simulated case, as if it is in a real patient that you are working on. So we are saying that a clinical simulation, it presents you, the learner, with a careful plan, simulated patient management situation. So we want you to do a management situation, but we will carefully plan it and simulate a patient so that you manage it for us to see, as if you are in the ward working on the real patient. Now, the clinical simulations are important because it helps you to bring about your cognitive and clinical decision-making skills. So cognitive is what? It's about the mind. That means when you have you must be able to think.
Sorry, sir, please, I'm getting confused.
Okay.
The way the explanation is more or less to me like demonstration. I'm not getting the clear difference between the stimulation and the demonstration. Thank you, sir.
Okay. Please wait.
Hello.
Okay.
Hello, sir. Please,
Yes.
your slide is too small. If you can zoom it a little bit for us.
Too small. Okay. Hope it's okay now.
Yes, please. Thank you.
Okay. It's okay. Great. All right. So we are saying that in a clinical simulation is not a demonstration. In a demonstration, we said the last time that here you are acting out a situation using to serve as concrete, to make it concrete for people to feel it as if it's a writing, and there it involves improvisation, which means that you may not use the real items, but you can use similar items to represent the actual thing that you are doing. Now, demonstration will not occur in a well-planned, structured, stimulated patient. So demonstration can occur anywhere in the classroom, and the environment, we may not plan the environment in a demonstration. So in a demonstration, we may not plan the environment, and we may not have to do any live stimulation for demonstration to occur. Now, the word we are doing here is clinical simulation. Now, in clinical simulation, we are saying that if you as a midwife, you are one of your duty is what to deliver a woman. And when you deliver the woman of a baby, we know that in resuscitating the baby, you have to meet the golden minute so that the baby can survive. Now, to be able to meet the golden minute, meeting the golden minute is done in a plan and a structured, in a simulated clinical situation. It's done in a plan, a structured, a simulated clinical situation. Here, we don't do improvisations. We don't do improvisations as we do in demonstration, where you can easily improvise anything just for people to see, to connect it to the real thing. In the clinical simulation, we have to use the real, not the real patient, but we know that the real patient, it has to be simulated to behave. Whatever we are using, we have to simulate the dummy or whatever we are using to behave like the real patient. So in this case of the clinical simulation, we are looking at the patient that is being stimulated to act as a real patient. So if it's about breathing, in the simulation, we have the stimulated patient that can breathe. We can do that so that you can get the real picture that we want you to get in the clinical simulation. Now, while we are doing the clinical simulation, is that in the clinical simulation, the patient is given specific instructions, and the patient response or okay, sorry. I had a little challenge, sorry. I'm back.
No, please say.
Okay. So sorry so much. So we're trying to explain the clinical simulation. So we are saying that in the clinical simulation, we have a patient that is being simulated or induced to act out as a real patient, and the healthcare provider responds appropriately to the needs of the patient. Now, in the clinical situation, we have it's a live case. It's a live case that you have to attend to. It's a live case that you have to attend to. But in the demonstration, we are just trying to use improvisations to just try to explain to you for you to see how it is done in reality, but it is not in a structured or organized form. So when we take an example, I have an example which we'll all take and we'll respond to. So I'm sure the example, we may understand it better. Now, why are clinical situations, the simulations, why are they useful? Why are they useful? So clinical simulation, we said they are useful to help us respond to emergency situations. So most of them, they are life-saving situations that we use the clinical simulations so that you know how to attend to it. Then when you are faced with that same emergency, you will be of much help. So mostly it's about responding to emergencies. And as we started, the golden minute is an emergency. So mostly at the accident and emergency ward, we have most of the clinical simulations over there. Most of the cases that we can put them as clinical simulations so that you can know how to think about it and act appropriately. Now, it helps us to develop critical thinking skills. Because it's an emergency, it means that you have to be fast at thinking. If you have a thought block, it means that the patient is likely to lose his or her life. So it makes you to think fast and to be able to help the patient as much as possible. Now, the third point, it assesses students' ability to integrate knowledge, skills, and attitude into providing healthcare in a simulated setting. And here we are using an example of an OSCE, which all of us have done OSCE before. And OSCE refers to...
I don't know what OSCE is.
Oh, you don't know what OSCE? Okay. So I'll give you an example of an OSCE. An OSCE, the O represents objective. The S represents structured. The C is clinical. The E is examination. So the full meaning of OSCE is objectively structured clinical examination.
Sir,
So yes,
I
please.
think the OSCE, we have a different name for it in our setting. It's the degree people that have they are using, like sisters, whenever we are doing our practical for the licensure exams, you see a doctor will be called, then you go to the doctor, they'll present to you maybe the fetal skull. You have to
That one is Viva. Oh, that one is Viva.
Yeah, that one is Viva.
They call it OSCE. Those who went for degree, no.
Doctor's corner.
They call it.
Hey, allow the tutor to explain la.
Allow the tutor to explain.
Okay, so yeah, you are giving your opinion. That's very important. So you are talking about the Viva, the doctor's corner. So whether diploma or degree, we all do doctor's corner. And it is the same name we give to it from NMT. It's called Viva. So Viva Voci Doctor's Corner. All right. Now in the OPSKI presents you. So OPSKI presents you with an emergency in a clinical setting. So to get
please, you didn't finish giving us the full meaning of the OPSKI, and she came in.
Objective. The O is objective. Please, the O is objective. The S is structured, to structure something, structured. The C is clinical. And then the E is examination.
I beg you. You are not sure. Let me take that risk.
Thank you, sir.
Is anything about taking some maybe lesson and everything? I beg you. Let me take that risk.
Please, can you take yourself out? I'm not a host now.
Thank you.
Patience Aqua, please mute yourself. You are in class. Patience Aqua.
Who's that? Modesta. Joseph, please could you give me access to mute and unmute them? I lost friends when I joined. Okay. Now I can see that I'm a host. Thank you. So did you get the full meaning? So objective, structured, clinical examination. Now in an OPSKI, if we want you to do the golden minute, in an OPSKI, what we do is that just as you have the normal setup in the hospital, when you're about to deliver, we will ensure that we have stations. So we have station 1, station 2, station 3. Now, the station 1 may involve washing of hands. So in a classroom or wherever we are doing the OPSKI, we will make sure that in that particular classroom where you come in and we give you your objective, your OPSKI question, if it's on the golden minute, we'll make sure that particular classroom, 1, it has a place where you can wash your hand. And we expect that that's the step 1 should follow. Go and wash your hand. Then when you wash your hand and come, we expect you to set up your place. So set up your emergency equipment you are going to use for the golden minute. And we'll have a table where we'll put all these equipments there. So we'll put all of them there. Then you have to select what you need and now arrange for your OPSKI. Now, in the OPSKI, so it is a life scenario. We have a patient, we have a baby, and we can put the baby, for example, as you're about to deliver, we can just have a pregnant woman that the baby has crowned. So we'll have a dummy where we have the pregnant woman, then we put the baby inside, just about to deliver it. And your job will be that you deliver the baby in the clinical situation as an OPSKI. You deliver the baby as an OPSKI. Immediately you bring the baby out. You should start with your golden minute. So it is the ward situation that we have arranged, and the baby and the woman is said that they are stimulated to act accordingly. That you can even communicate with the woman. Now, that kind of environment, we are saying it's a clinical environment. It is set up as if you are in the ward doing the actual delivery on a woman. but you have to go through the whole process practically with speed, with agency, and you must meet the time that we have set for you. So if there's 1 minute and you enter, immediately you enter, you have to start. And within the 1 minute, you have to be able to resuscitate your baby or meet the golden minute. So that kind of exam is an OPSCI exam. That kind of exam is really an OPSCI exam. It's different from the Viva Voce. That one is different from the Viva Voce. It's really different. Yes. Now, another advantage or usefulness of the clinical simulation is that we can use clinical simulations over and over till we understand it. Over and over till we understand it. Now, some 5 years ago, I went for a training on helping babies, essential training on helping babies to breathe. And maybe some of you have gone for that training before.
Yes, yes, please.
Yes, essential care of the newborn to breathe within the golden minute. And after we have been taken through, they have done demonstration on how the baby can be resuscitated. They now have to set up an OSCE exam.
Exactly.
Where all the participants on that day is your OSCE examination day after the workshop. You come in and they have set up the place as a clinical situation. And you have to carry on step by step, as if you're in the hospital, and you have a time to meet. So that kind of workshop you go for, where practically you are taught, then they set up the clinical situation for you to intervene in case of emergency. That is an OPSCE exam that you are writing. That is really a perfect example of an OPSCE. That you have to do it for them to know that really you've understood, and that if you go to the ward, you can actually manage the patient practically as you are expected to. That's really an OPSCE exam. Yeah, somebody's hand is up. Yeah, Josephine, your hand is up. Then Rebecca, your hand is up. Yeah,
Okay,
Josephine.
Sir, good morning.
Good morning.
Please, with the OPSCE, could it be the same as the ward assessment they normally do for the midwives?
So specifically on what?
Could be on either family planning or labor.
On family planning or labor.
Yes.
Okay, so in the family planning or labor, as you have mentioned, OPSCE occur in several clinical situations. So this example we have given is a specific example to labor. Now, if we also come to the ANC, as you have indicated, we can also have a woman that we can stimulate in the form of a dummy too. And you can serve as a help provider to carry out whatever that you are to do. So yes, OPSCE can occur in all sectors, whether at the labor. Sorry.
Hey, Sandra, if I mute your mic.
Please, who is a mute, please? Yeah, so just when we can conduct OPSCE also in the family planning unit. Yes, we can conduct OPSCE. Now, it becomes an OPSCE if we are not using a real patient. So if we are not using a real patient, but rather we have stimulated. So the stimulation is a key word. So that's why in the various schools or in the various skills lab, we have types of dummies. We have simulated dummies. And so the simulated dummy will act just as a normal human being will act and give responses. So when we have that stimulation, then we can do the OSCE exam as well. Somebody's hand is up. Anne, your hand is up. Rebecca's hand was up. I've not heard from her.
Yes, sir.
Yes.
Sir, thank you. I just wanted to give a little bit explanation with the OSCE aspect, because I'm a regional TOT for helping babies breathe.
All right. That's
what
good.
I wanted for us to understand is that
yes,
with the OSCE, which is an objective structured clinical examination, it is done when the training is ongoing or we are finishing the training at the moment. That's the OSCE. And sometimes we do it during the visit to a facility who has undergone the training. So after the training, we have something we call clinical drills, whereby the hospitals or every facility that has undergone the training have to be taken through those things. So, like for example, the drills, the OSCE is during the training, and then the drills where we have drill books is within the facility. So every midwife who undergone the helping baby breathe training, every time that you are close or you're close going home or with your free time, you come and do the drills so that you have the retentive memory. So whenever you have a baby that you need to do the resuscitation, you have that skills to be able to do it. So that's my explanation for the OSCE and then the drills with the clinical settings. Thank you.
Okay, thank you so much, Rebecca. Also, yeah. So these drills is true, Rebecca. It's true. I know the training we went for after the OSCE. I think in 2 months' time, the team came back to our school. Yes, the team came back to our school, and they selected 3 of us for the drills. They selected 3 of us, and we did the drills at our skills lab. So yes, it's true what you've explained. We went through that same thing after the training. Then Anne, your hand too is up. Do you want to add up to something? Anne, please.
Good morning.
Yes, good morning.
It's a question.
Okay.
I don't know if it falls under the medical simulation. Like when you come to my hospital CAT, when the medical students are about finishing school, their final practicals, they select some of us from the ward. We go for 1 week rehearsal. They give us specific instructions to follow. So they will divide the room into cubicles, small. Then when the medical student comes, maybe he will touch your right hand. All of us know that when the medical student touches right hand, you are supposed to say it's not paining you, because they are looking out for a particular diagnosis from the medical student. So we have all studied one thing, and then they will be asking the question, and then we will be answering. I don't know. It is a clinical set. You have everything. You'll be lying on the bed. You'll be covered with bed sheets, and then we'll be answering their questions. We are not supposed to say anything outside the instructions we are being given till the exams is over. I don't know if this falls under the clinical simulation.
Yeah, so my sister, that is the clinical simulation, and what the medical students do, as you rightly said, that is an OSCE. So that exams that you have been trained for them to write, that is really an OSCE exams, and the medical students, their exams, practical exams, takes in the form of an OSCE. So in the OSCE, it's like you are simulated. You are now the simulated patient. You are serving as a simulated patient, such that you are giving specific instruction and specific responses to give. So that is a simulation. So if we are using human beings for a simulation, just as you said, the human beings, you are trained on how to act, your actions and reactions. There are specific action and reactions that you have been trained on. So that when the health provider is touching you or is doing any assessment, you have to behave in a certain way. So that means you have now served as
Say the ebediano no. Obama say na chira de mo de oski. And I did not take.
Pacho mo mo ni mo ade no mu nya botana lecture no nkyere wa ye ne ye nim na ensua ye pa bacha opi ndamasi.
Hey,
I've been sister Abena, so we can't ask question Anna. Yenti adena say na yebisa. I'm not say watch.
Hello, everyone.
Hi,
Hello,
sir.
sir.
Hi, please, we are here.
Okay. I've been given light out, but I'm using a connection from a desktop. Sorry. All right. So my sister, what we said is that is a perfect example of an OPSCI exams, and we are saying that an OPSCI exams is an example of a clinical simulation. So you are clinical simulated as a patient, and you are giving specific instructions, you are giving specific responses. Then the healthcare provider undertakes his or her management practices. So we want the healthcare professional to manage a case so that when you meet it after your training, then you offer the same help and the same emergency that we need it to be done. Now, the next thing is to look at an example. We have to look at an example of a clinical simulation and how we can respond to that example if we were present. If we were present, how we respond to that clinical simulation. Now, the example I want us to look at is on, it's on vaginal bleeding. So we want to look at a clinical simulation on vaginal bleeding as a case. It's a clinical situation of vaginal bleeding. So let me see if I can share it. No, I'm not sharing the screen yet. That's right, please. I'll switch to my phone and this. Okay. So you soon see the screen. Just some patience. I want to create. I want to ask for a favor from you. Our time is almost up, but I have a difficulty here. Is it possible you can give me about 30 minutes or 1 hour within this week, any day at all, so that I can do the practical example of clinical simulation, because it's important. And it's one of the things that I want to see practical for yourself and to respond to it. So please, I want to, if it's possible, can we get 1 hour within the week from Monday to Saturday or Monday to Friday, just 1 hour, any day at all? So that I'll just do this thing for you.
Yes, sir.
Yes, sir.
Yes, sir. No problem.
Yes, sir.
So please, I will allow you to discuss maybe later on your platform, and you just gave me at least 1 hour. Just later on your platform, choose a specific date that will be convenient for all of you and the time.
Sir, Tuesday.
Then you let me know. I can tell the IT people to prepare.
You said we should
Tuesday.
discuss. Don't
Sir, you give us a day.
No, for me, I'm okay. Just you discuss. You are workers. Just discuss. Give me a date and a time. I'll
sir.
respond.
We'll discuss with our reps. They will communicate back.
That one is 25. The blue one is 25.
So I'll play with you. Let's end the lecture here. When I get the 1 hour, then we'll finish it up, please.
Hey, that's suspension for adults.
So sorry for the inconvenience.
For adults. Adult learners, you can make noise. Mostly class people.
Yes, so what? Somebody asked whether please then we can close and meet when you give me the time. It's important. All right.
Okay, sir.
Off your mind.
So I wish you all the best in your next lecture. We'll meet.
Hello, sir. Please, my hand is up.
Yeah, Betty.
Hello,
Betty,
sir.
you can talk. Yes, please.
Okay, please. My concern is on last week's lecture. It's not on YouTube. Can you help us with the slides on the page?
Oh yes, please.
All right.
Yes,
Thank you very much.
yes,
How much?
I'll do.
That's the max.
All right. Thank you.
Thank you, sir.
I've seen somebody's message. The person asked whether clinical simulation is a teaching methodology. Yes, it's a teaching methodology. So clinical simulation is a teaching methodology. It's one of the effective teaching methodologies that you can have. Yeah. I think that's all. Okay, somebody asked your handout. Okay, you get back to the course reps. You get a feedback on that, please. So thank you so much for your time. We will meet when you get me that time. Thank you. Bye to everybody.
Bye.
Bye.
Bye. This time I'm looking for you, and I have blood. You also.